Dr. Lewis with Spinal Health and Nutrition. Today we're going to talk about a very serious topic. It's another type of inflammatory arthritic condition. It is called gout, okay? What is it? Gout is a form of inflammatory arthritis caused by the accumulation of uric acid crystals in the joints, okay? It always likes to go to either the knee or the big toe. The reason being because those particular areas in our bodies have cooler temperatures for those uric acid crystals to develop, okay? Now, what does the uric acid crystals look like, all right? Now, you go to your doctor and they take a urine sample or blood sample and they run it through the lab. After they run it through the lab, they look at the sample under the microscope, okay? And when they look at it through the microscope, it looks like sharp pieces of glass. Can you imagine having a sharp piece of glass in between your joints? That's very painful. It literally looks like sharp pieces of glass, okay? And that's why it's so painful, all right? And I want to go through what increases the uric acid production, okay? It could be genetic factors, all right? That's why it's so important to know your family history. What are some of the health issues that's going on in your family? All right. And you want to get yourself checked out just to see if you also have that in your genes as well. Okay. Certain medications can do it. All right. Once again, please read the ingredients of what's being prescribed and know those ingredients. All right. If it has like diuretics, cyclobenzaprine in it, that can lead to gout. All right. So we have to follow the correct dosage of those medications. Okay. Certain foods and beverages, especially alcohol, can do it, all right? There are certain foods out there and beverages that has purines in it. Purines, once there's a high level of purines in the bloodstream, that can form uric acids, okay? And those uric acids, if it's not dealt with in a timely manner, can develop crystals in between the joints, all right? Beverages that are high in sugar, sodas and juices can also do it as well because of the high amount of high fructose corn syrup. That you have the high fructose corn syrup that's in the bloodstream that can also develop uric acid crystals and it starts settling at those joints. Okay. Now, who is more likely to get it? Adults between the ages of 30 and 50, especially men. They're more likely to get it. Okay. And also people with metabolic syndrome, okay? Once again, diabetes. Diabetes, once again, is a complicated condition. It can cause all sorts of problems, strokes, gout, skin infections, heart attacks, and visual problems as well. But metabolic syndromes, as far as the diabetes, can also do it because if someone is a diabetic, their bodies become insulin resistant, okay? And that will lead to an increase in glucose levels in the bloodstream. When there's a high amount of glucose levels in the bloodstream, the glucose converts into uric acid, and then it's going to lead to a decrease in, as far as the kidneys, trying to eliminate those uric acid out of bodies, okay? So that can also lead to gout as well, all right? Now, what are the symptoms? Very simple. Painful joints on the knees and also on the big toe. Swelling on the knee and big toe. Painful to the touch. Difficulty walking. Difficulty standing. All right. Very, very painful when you're putting on shoes and socks. Anything that would touch that area where there's gout will cause pain. Okay. So it has to be dealt with in a timely manner. All right. Now I'm going to go through some natural treatments that we can do. Okay. The sooner the better, because if we wait till the last minute, then we had no other choice but to be put on medication, okay? So we have to catch this as soon as possible, all right? If it's not treated, that gout can lead to erosion of the bones. And we don't want to go through having a bone replacement on the knee or the big toe, okay? So I'm going to give you all some simple steps that we can do to help flush out these uric acid crystals, okay? We must stay hydrated. We have to stay hydrated. We got to drink plenty of water, all right? We have to limit the sodas, limit the juices, the alcohol, because alcohol has a high amount of purines in there that can develop uric acid crystals. So we have to keep ourselves hydrated by drinking water. Keeping ourselves hydrated will help dilute the crystals in our bodies, and they will flush out those uric acid crystals as well and help eliminate it. Okay. We have to limit purine rich foods, especially seafood. Okay. Me personally, I love seafood. All right. I like my crabs. I like my lobster. I like my crab cakes, my shrimp. I love that stuff. Okay. But moderation is key. All right. If we overconsume the seafood, and also there's a high amount of purines in red meat, we're going to put ourselves at risk of having this type of condition, the gout. Okay. All right. Because the seafood and the red meats have a high amount of purines in there, which can lead to the development of these uric acid crystals. So we have to limit that stuff. All right. I mentioned that we have to limit the alcohol and sugary drinks. We must focus on low purine foods such as our fruits, vegetables, nuts. All right. You know what I mean by nuts? A good nut, some good amount of nuts to snack on are the pistachios and also our walnuts. Okay. Those are good nuts to snack on because it has a good amount of fats in it. All right. Our bodies need fat, but we want to have the good fats. Okay. The omega threes. Okay. Because it's the omega threes that will help, especially if you have issues with cholesterol, help lower the cholesterol as well. Okay. And it has a good source of antioxidants in it to help reduce inflammation. Okay. Definitely take the vitamin C. Okay. Vitamin C will also help eliminate uric acid crystals. Okay. Definitely take the vitamin C. Take this daily. It will help eliminate. All right. If you are having some pain and symptoms, go through some pain management procedures, okay? Ice the area, ice the affected area. I'm saying this several times because a lot of people make a mistake and put heat on the area. I know heat feels good, but what heat does is that it dilates the blood vessels, leading to more swelling on the joints. And when there's more swelling on the joints, it's going to cause more pain because the more fluid we have, the more pressure that we're going to have on the nerve. Ice it down. We have to rest the affected area as well. Okay, get off your feet and rest. All right, elevate it. When you're off your feet and resting, elevate that area. Elevate that affected knee, that affected foot, where the gout is settling on that big toe. Because if you elevate it while you're putting ice on it, that will help reduce the swelling. Okay. Also, use ginger as a natural anti-inflammatory. That would definitely help eliminate those uric acid crystals. Okay, you can get ginger in two forms. You can get the ginger powder if you don't want to go through spend a lot of time trying to cut that thick ginger root. Okay, and just put it in hot water, put it in your tea, and that will definitely help flush out the uric acid crystals. Okay, another thing you can use is organic cherry juice as well. Okay, but if you don't want to consume the high amount of sugary flavor, use the ginger. All right. That will help reduce. Okay. Once again, we have to catch this as soon as possible. Catch the initial signs of it. Don't wait too late. If you wait too late, then you will have to be placed on medication to help flush out those uric acid crystals. Okay. All right. I'm Dr. Lewis. Please subscribe and share to our YouTube channel. And remember, your health is your greatest investment.